I think we're trying to figure out exactly the best way to do ACL reconstructions now. We are developing more anatomic ways of doing ACL reconstructions. For a long time, they were done in a way that wasn't particularly anatomic, and I think as a result of that, patients had good knees, but not necessarily great knees. And now we're trying to look at more the exact anatomy of the native ACL and trying to reproduce that with our reconstructions. And along with that, we've had to figure out changes in how we do the rehab and so forth. So that's kind of a work in progress, if you will. And then, what do you use to make the new ACL, and how do you fix it? There's a lot going on in the ACL reconstruction community, if you will, about where we're going and how to do it in the best way. The things we're seeing with ACL grafts, for instance, typically there's been the patellar tendon, using your own patellar tendon, using your own hamstring, or you can use allograft, which is cadaver tissue, which is donated tissue. And what we've seen is that in the young athlete, the failure rate for cadaver tissue is really quite high. In older patients, middle-aged adults and so forth, who are not putting that much stress on their reconstruction, it's probably an acceptable graft to use. But for a younger patient, you really want to use your own tissue. One of the things that we are trying to do here at Concord Orthopaedics is establish some testing criteria after we do ACL surgery. At the University of Pittsburgh Medical Center, they have developed a very good protocol, in my opinion, for post-op rehab after an ACL, because for years it was always just sort of a timing thing, and everyone assumed that, okay, after 6 months your ACL is healed, you're ready to go back. But we've seen that the incidence of re-tear, particularly in young female athletes, is very high. And when they've gone back and tested that demographic, they've found that they are simply not ready to go back. And even when they test guys and higher end athletes, they're just not ready to go back. And I think people see professional athletes and they're back in 6 months or 9 months. And what they don't see is that they're in the gym working out, in the training room working out 6 hours a day. And none of us really can do that. We've got school, we've got work, we've got parenting responsibilities, etc. But by using a rehab protocol where you have to pass certain tests before you go to the next stage, you know if you're ready or not. And they're very objective tests. How far can you hop? How strong is your repaired leg compared to the non-injured leg? And if you're not at a certain level, you're really not ready to move on to the next thing. And so you have to test and pass all these tests before you move on, and especially before you move on to returning back to sports.